myself, Sridhar D from Manipal University. Okay, from Manipal College of Health Professionals, which is one of the constituent institution in the Manipal University. It is one of the skill-based work it is from the occupational therapy point of view, and all the occupation therapists shall have this skill. Okay, and also it is one of the part of the intervention in terms of a rehabilitation. Many people needed this particular services in the society. Occupation therapists are specialized in that, so that it will be definitely game changer, and they can able to start a new center also, which they can able to propel themselves as independent practitioners in the field of hand splinting also. Common error is not in terms of fabrications. It is basically they lack a little knowledge in that. One thing. Second thing is after gaining the knowledge, they have to practice continuously. Okay, that is one thing, and there is a good challenge will be there, because we have to handle many patients. Each patient should be handled individually, and we are making a custom-made splints that on, so that we have to take utmost caution when we are fabricating that particular splints and deliver it to them, and that gets benefited to them in a larger perspective. Yeah, basically like we can have the thorough knowledge should be there, and we have to take some sort of practice. Okay, in terms of like a minimum of 50 hours to 100 hours is necessary to make the thing. And second thing is that if you want to make it little more mastering in that, they have to be hands-on practice it is. Okay, that's very, very important for them to get it mastered. Yes, definitely there is a lot of scope is there, which the students, current students will become graduates. Those graduates will come into the pictures of practitioners, and they can able to go into the hospital segment, other rehabilitation segments, to explore this hand splinting possibilities, and then they can able to work upon in collaborations, and that will benefit them into the better things in the society. Piece of advice is, see, once they become a graduate, they are going to practice, and whatever the learning has happened, they are going to practice, and then they see how they have to polish themselves. Okay, and that polishing it takes around 1 year to 2 years of time duration. Okay, then they will mature in their practice, and then they will slowly correcting themselves, and then they become good practitioners in this. So that time is necessary to make them to go into the rehabilitation. At the same time, we have to see all the opportunity which they can able to tap from various segment, and then they have to go boldly to ask for the referral, seeking the referral, or else projecting themselves that they can able to make a sprint and deliver it. So those sort of things which may be like helpful for them to stand alone and then try to make the sprints for the various conditions and also people at the need. Yeah, it is a very basic necessity coming out of the classroom activity, and people will feel little more ease in learning. Another thing is that there is an openness to ask the clarifications with additional or external faculties. They also feel a little more interactive, and that will definitely boost the confidence with them. Okay. Along with the in-services, what they are teaching it, one additional things is necessary during the course time. That will morally it will boost up them the way of a confident, and also they are also other the different varieties of learning, which platform that can be utilized.
A general question, like how do you feel in this?
Yeah, I feel comfortable. I have been here for many times. That's it. Basically, I just want to give an inputs. What are the things is possible and how we can able to make it. Basically, another thing is that I want to put it. The people should able to aware about it. If you don't make them aware, they won't explore it. So if they don't explore, they may not see the different venture to swim through.